Okay, here we're going to talk about basically the story of Penny, and that's essentially the pectoral region's nerve supply. So we're talking about the nerve supply or the cutaneous nerve supply of the pectoral region. Now, it's not very difficult if you remember a phrase and a couple of numbers. So the pectoral region is essentially the region which is kind of laterally to the sternum, which the sternum would be found here. So it's kind of laterally to the sternum and it goes up to the mid-axillary line and it's below the clavicle, and here would be your deltoid. So those are the regions of it, but the focus of this video is not on the landmarks but more so on the nerve supply. Now if you talk about Penny, so Penny, when she was 26, so notice that there are two regions, there are two areas of the pectoral region. There's an upper pectoral region and a lower pectoral region. And within the lower pectoral region, Penny, when she was lower, so when she was 26, so younger, she had a lac. So remember, inco, lac. So she had a lac. And these are the nerves that you can find here in the lower region. And lac is for the lateral and the anterior cutaneous nerves. Lateral and anterior cutaneous branches. And these are branches of intercostal nerves. So here we're talking about intercostal nerves and we're talking about their branches. So LAC stands for lateral and anterior cutaneous branches. Of course, anterior can come first, anterior cutaneous branches. And the other nerve that's important here is intra or intercostobrachial. Intercostobrachial nerve, which is actually the lateral branch of the second intercostal nerve. But the main part here is the intercostobrachial nerve, which, by the way, also supplies the floor of the axilla and the medial part of the posterior part of the medial side of the arm. Okay? So, a quick reminder. The upper part of the pectoral region and the lower part of the pectoral region are divided, and the division between these is marked by the second rib. And in the lower part, when Penny was 26, she had a lac, so inco lac. And the lac is for lateral and anterior cutaneous nerve branches of the intercostal nerves, and INCO stands for intercostobrachial. And the reason why I talk about 26 is because the nerve supply of the lower part of the pectoral region is from T2 to T3 to T4 to T5 to T6. Okay? From T2 to T6. Now, one part of the cervical plexus does supply the superior part of the upper part of the pectoral region. But mostly, so here, it's from T2 to T6. One key thing that you need to note is that C5 to T1 do not supply cutaneous innervation to the pectoral region because, of course, these are for the brachial plexus. That's for the brachial plexus. Now, if I'm a little bit more specific, the anterior cutaneous branches come from T2 to T6. The lateral cutaneous branches come from T3 to T6. And the intercostobrachial nerve comes only from T2. So that's kind of what you have to remember for the lower part of the pectoral region. For the upper part of the pectoral region, When she gets a bit older, so when she turns 34, she's super, because she's finally got, you can either remember as milk or she's met someone, so mill. And that's super because here the nerve supply to the upper part of the pectoral region will be by the supraclavicular nerves, because you have the medial, mill. You've got the medial, the intermediate, and lateral supraclavicular nerves. By the way, the supraclavicular nerves come from C3 and C4 of the cervical plexus.